Hi, I'm Elizabeth Lamb, and this is my 335 reflection video. For this clinical, we were given 8 objectives, so I'm going to go through and state each objective and how I met each of them with my clinical experiences. So objective 1 was to utilize previous knowledge of the sciences, liberal arts, infotechnology, and nursing to develop skills as a nurse leader. I believe that I fulfilled this clinical objective by attending my peer leadership clinicals, and I attended 2. One was with 313 in mental health and 320 in mom baby. While I was in mental health, I was able to assist the students with therapeutic communication with the patients, go over the many mental status assessments, withdrawal assessments, and help them with anything else on their clinical checklist that they needed to fulfill that day. I was also able to ask them test questions and go over some good testing strategies. And then during my 320 peer leadership clinical experience, was able to help students with postpartum assessments, monitoring and looking at fetal heart rate rhythms and seeing what was going on in them, as well as baby assessments and the importance of giving meds early after birth. I also completed this objective during my nurse supervisor experience. So I shadowed a nurse supervisor overnight at Lehigh Valley, and there was a patient who wanted to leave the hospital, but it wasn't safe for her to do so. And so the nurse supervisor and I were called, and she was able to speak with the patient and have her come to her own decision to stay in the hospital. I was also able to use my therapeutic communication I've learned in my previous classes, such as 309 and 311, to help explain to this patient why it was in her best interest to stay in the hospital, so she was not 302'd. The second objective was to apply the basic principles of ethics and management to meet the challenge of the ever-changing healthcare system. So I believe I met this objective through my experience at Patient Logistics. Patients are always changing. There's more coming in, some leaving. They need to go to different floors if their health status changes. There's staffing changes. So the nurses that work in Patient Logistics have to take into account the acuity of patients and what they might need, and if there's a staffing available to help them with that. And they definitely have to think about the ethical side of, we have this bed open, but we need to keep it open for a patient who might need to be in an ICU versus putting just a simple med-surg patient there. I also met this objective again through my nurse supervisor experience, because she went to each floor and would ask about their staffing needs, how many people they thought they would be getting in later in the night, and how their census was doing at the time. And she really used some good motivation to get her staff on each floor to work hard and be honest with her. And I think it's the relationship she's built is what allows the staff to be honest with her if they have too many or too few nurses. So our third objective was to demonstrate leadership skills through effective use of communication by representing myself, the college, and nursing in a professional manner. So I met this objective primarily through sending emails to set up all my clinical experiences, and I introduced myself, told them that I went to Cedar Crest, that I was a senior nursing student. I explained what we were hoping to gain from our leadership class and clinical. I told them how many hours I would be at their site, and then I gave them a list of days where I was available, hoping that they also had some available days that I gave them that we could match up for my experiences. And then as I arrived at each clinical setting, I made sure that I was on time and early so that I wasn't keeping them from starting their day the way they wanted. I was dressed professionally, and I made sure that everyone I came in contact with, I shook their hand and I said, thank you for allowing me to be here and asking questions. And I made sure to introduce myself so everyone who I met throughout the day knew who I was. I also thought that I represented nursing in a professional manner during my interprofessional experience because I was shadowing dietitians, and although dietitians and nurses work on the floor together often, we don't often have time while we're working to just have casual conversation back and forth about what nurses need and what dietitians need from each other. And so I was able already as a nursing student to explain to the dietitians about different things that I've come across in my clinical with diets and eating and education to patients and how we can better be on the same page to provide better health care to the patients. So objective 4 was to critically evaluate and disseminate current research related to principles of leadership and the effects on the healthcare system. So I researched this article by Scully, and she stated that leadership is not synonymous with management. And I really agree with this because management is as we learned in leadership class, is a formal title. You're leading because you have the title of a supervisor or director, versus someone who's a leader on the floor is an informal leader, most often because they have expertise and knowledge of skills that they've gained during their time working on the unit. And so Scully says that leaders derive their power from knowledge, as we learned in class. However, management is from the position of power. And Scully suggests that leaders do the right thing because they want to and they know that's what needs to be done to better the patient's outcomes, while management does things right because people are looking up to them and they're being watched by higher management. And I think that it's important because as a newly graduated nurse, I want to work on a unit where the leadership, both formal and informal, are invested in furthering my knowledge and helping me become proficient in my skills. And Scully says that the next generation of nursing leaders need to want to broaden the skills of new nurses and everyone else on their unit. So objective 5 is to function as a competent patient advocate, nurse advocate, and change agent. So again, I met this through my interprofessional experience with the dietitians at St. Luke's. We met with nurses as well as doctors to decide diets for everyone. And there was a particular patient who sticks out to me. She was receiving chemo and she wasn't very hungry and she was losing weight, so it was important to everyone on her healthcare team that she started eating. However, she really wanted potatoes for breakfast. She really wanted them for every meal, but the healthcare team felt that would provide her with too much potassium in her diet. And so they told her this and she refused to eat for a day. So the dietitian and the nurse both came back to the doctor and said that could we give the patient just the potatoes for breakfast, and then she'll agree to eat whatever meals are provided the rest of the day. And so this is a great example of both the nurse and the dietitian advocating for the patient. Another way I met this objective was through my community experience, and I attended a care class at Sacred Heart, and it focused on behavioral health units and restraint and safety. And I think it's important that when we talk about restraints that we are advocating for our patient to be in the least restrictive environment as possible. And we have to think, is it ethically okay to restrain this patient? Have we taken the proper steps before using hard restraints with the patient? And making sure that we're advocating the doctor as well as other nurses are coming around to do their hourly checks on them. So objective 6 was to formulate plans for continuing personal leadership growth and development as an independent practitioner of nursing and contributing member of society. So I met this objective through volunteering at Special Olympics. So the first portion of the night, I helped younger kids who weren't as good at swimming yet just enjoy being in the water and being active and having fun with other kids. And then the second half of the night was definitely more of a coaching type of position where I would give out strokes and critique more experienced swimmers who compete in Special Olympics swimming meets on the weekend. And I think it's important that you give back to the community because we see so many people in the hospital sick and down and not being active. And it's important to promote healthy lifestyles for all populations. especially those who can participate in Special Olympics. It was great to see them being out and active and enjoying themselves and laughing. And I know I definitely had a lot of fun helping them swim. The kids were great. So another way I met this objective was I attended USA Field Hockey Summit, and I have aspirations to become an international umpire. And many people may say, well, what does umpiring and nursing have in common? But since I've been in nursing school, I've really been able to see a lot of similarities. So in umpiring for field hockey, I see a foul, and I have a split second to recognize that it's a foul, decide what kind of foul it is, and what the consequence is going to be, and how I'm going to blow my whistle to show everyone on the field. Well, in nursing, sometimes you have a split second to make a decision or to catch something about your patient's condition that could help save their life in the end. So attending this seminar that weekend, I was able to take a class about being mentally tough, and I think that's very important for nurses so that we don't burn out. And say we have a bad day and patients aren't doing well and they're declining, we need to be able to say we're doing everything we can and be confident in our skills and embrace being a leader. Because whether I'm umpiring on the field hockey field or I'm a nurse in the hospital, it's important that I'm confident in my skills and that I show my patients that I'm competent and I know what I'm doing to provide them the best health care. So Objective 7 was to recognize the role of the nurse in policy making related to healthcare services at local, state, national, and global levels. So this objective was completed by attending Capitol Hill Day. We spoke with our local senator about nursing staffing and mandatory overtime, and how we feel it's not correct to force nurses to work overtime or to be understaffed when it's really the patient's lives who are at risk. And we also felt strongly about that there's no nursing position of power in legislature. How can someone who's not an RN or gone through school to be a nurse or is an advanced practice nurse, how can someone who doesn't have those things make decisions for us when there's doctors who sit in the legislative branches? So it was important for us to advocate that we felt we need to create a position for nursing to continue to advocate for ourselves and change in our careers. Another way I met this objective was through my advanced practice experience. I shadowed a nurse practitioner who is the director of pediatric rehab at Good Shepherd, and she was working on policies the day I was there about trainings and how often her staff needs to go to trainings to meet other policies set upon her by the state. So it was interesting to see a different part of nursing where we're making policies in our day-to-day jobs. Objective 8 is to predict and describe potential ethical dilemmas within the clinical, organizational, and professional nursing practice. So I researched an article about pediatrics and minors making medical decisions. I think this is really important as I personally am interested in going into pediatrics after graduation. And this article states that there's 4 standards that a minor must meet in order to be considered this idea of a mature minor who can make a medical decision. So these 4 standards are to express a choice. They must be able to clearly communicate with us either verbally or non-verbally or through written language to say what they want in their healthcare. They also must understand what's happening. They need to understand what's wrong with them, what the options are that are proposed, and all of the long-term effects that they could have based on their decision. The last 2 reasons are more abstract. So the third one is reasoning. They need to be able to weigh the risk versus benefit. And I thought that this article did a great way of presenting this because they brought up the idea if a minor needs to have their leg amputated because of an infection, they can have the leg amputated now, and that child may see that they won't have a leg and they won't be able to be active. However, the other option is to keep their leg, but then the infection could get into their bloodstream and they could end up possibly dying. So a child may think immediately, oh, I need to keep my leg because I want to run. This may indicate that the minor is not mature enough to make a decision. because they need to weigh the risk of possible death. So the next one is appreciation about abstract thinking and being able to sort of look into the future and see, well, I might not have my leg, but I'll be healthy and I can get a prosthetic and be active. And according to the ANA Code of Ethics, we must advocate for our patients primarily. So I think it's important that regardless of the age, we are asking what the patient wants and providing support for them. And this concludes my Nursing 335 reflection video. Thank you.